So here we are in the Tynwald Chamber. It's a Thursday afternoon, and in just a few minutes' time there'll be a special extraordinary sitting of Tynwald here today, followed by a short sitting in the House of Keys. Everyone is being placed in various different places. A lot of members are upstairs in the public gallery. Now, the Chief Minister is expected to make a statement about coronavirus. Also following that, the Treasury Minister, Alf Cannon, will be bringing some measures forward. And in general, this is just making sure that more legislation is on the books. Obviously, we're hearing now that numbers have gone up by another 3 today, and the press conference with the Chief Minister and also a member of the retail trade from the Co-op will be at 4:30 this afternoon, when again we can ask some more questions and find out what's going on and what protections are going on, especially as the Isle of Man has now basically pulled up the drawbridge completely following the last sailing coming this morning at 6:30.
Honourable Members, this further extraordinary sitting is being held to ensure the continued effective management of the present emergency by members of government and staff and officers to whom I pay tribute for their efforts. Also, the people of the Isle of Man should be thanked for rising to the challenge in the changes to everyday life which we are all facing. Honourable Members, I've already made the point to Government that the business for an extraordinary sitting of Tynwald must be submitted to the Clerk of Tynwald's office in a timely manner. Notwithstanding the unprecedented pressures on officers, which I fully acknowledge, members are entitled to adequate time to scrutinise the orders they are being asked to consider. Considerably less than 24 hours was the case with today's orders. Honourable Members, I make the point again in anticipation of the possibility of another emergency sitting of Tynwald, and simply ask that the point be noted, please. Before we turn to the main order paper, I will give the opportunity, as has been the practice, for ministers to make an urgent statement. The Chief Minister, of course, has indicated, and this is on the order paper, but if any other minister wished to take the opportunity, I do so now. In that case, honourable members, item 1, suspension of standing orders. Chief Minister to move.
Thank you, Mr. President. I beg to move that the standing orders be suspended to extent necessary to allow the business on the order paper to be taken.
Treasury Minister, Mr. Cannon.
I beg to second.
Call. Is that agreed, honourable members?
Agreed.
Call on the clerk to lay papers.
Tamika Roche Whale the paper and visit Ensign Gist and Clark Ober Iara. I lay before the court the papers listed item 2 of the order paper.
Turn to item 3, statement by the Chief Minister on coronavirus. Chief Minister.
Thank you, Mr. President, and thank you for your understanding. And thank you for allowing me to make a brief statement today. I last addressed this honourable court only a few days ago. I reported to you then that the world was falling victim to a wicked and unforgiving virus. Mr. President, the world around us is in a different place, even just compared to the start of this week. According to the World Health Organization's figures, yesterday evening, global confirmed cases are approaching 500,000, with over 20,000 confirmed deaths. There is much debate about how accurate these figures might be. I am not going to comment on that, but one thing that seems indisputable is that no corner of the planet is being spared. The United States of America is now emerging as an epicentre of the pandemic. The United Kingdom yesterday saw its death toll rise to 578, an increase of more than 100 in a day. This is already a tragedy, and only likely to get worse. The British Prime Minister and Health Secretary have today confirmed that they have tested positive, and of course the Prince of Wales confirmed the same earlier this week. I am sure that all members of this honourable court will join me in sending our thoughts and prayers to everyone affected by this cruel and relentless virus. Mr. President, these are unprecedented times, and we have taken unprecedented steps to protect our island community. Today, our island is different. We have closed the borders. This morning, the Ben McCree arrived with 67 passengers. We have now stopped almost all arrivals onto the island. The only exceptions to this are the smallest possible number of people required for our critical national infrastructure or for the preservation of human life. Freight will continue to arrive on the island. I would like to put on record my thanks to all those who are working to maintain our crucial supply chains in the public and private sectors. These are the people whose efforts are often unrecognised. They deserve our thanks and respect. Mr. President, our island has been famous for its hospitality. Over recent years, it has welcomed holidaymakers and honeymooners from across the British Isles and further afield. So many people I have met have wanted to share with me their stories of their visits here. But things have changed, and we have had to make tough decisions. The decision to close our borders was not an easy one, but it was the right thing to do. The Council of Ministers listened to our medical professionals who told us that this was needed to give our health and social care system the best possible chance of managing the challenges ahead. They told us, and we took action. Mr. President, I am acutely aware that due to lockdowns around the world, some Manx residents, even with best endeavours, have not been able to return in time for the border closure. We realise the position this has placed some people in. I know that a number of members of this honourable court, myself included, have been contacted by constituents, and I would ask them to pass details on to the Cabinet Office team who are collating this information. We have looked at how we can support these residents. We will continue to do so as best we can. But the advice from our clinicians and public health colleagues is clear. Any loosening of the measures we have put in place will increase the risk to our island and our most vulnerable. They told us, and we took action. Mr. President, we all have a role to play in these extraordinary times. This honourable court has already confirmed a number of powers that we have requested, and I am extremely grateful. These were never powers I wished for, but they are powers we need. Today we are asking for more. I would like to thank honourable members for their support in these challenging times. National unity is crucial. Mr. President, government has a role to play. We have listened to the clinical experts, and that is what we have done. We will continue to do so. We took the tough decisions to close large sectors of our economy. We know the impact this has had on many. Again, we did this on the advice of clinicians. They told us that social distancing is the single most effective way to reduce the spread of the virus. They told us this, and we took action. I would like to commend the Treasury Minister and his department for their work to support our economy and our workforce. There is neither a magic wand nor a money tree out there. The package of measures that he has already announced has been well received by many. I know the Treasury Minister and his department are working flat out with colleagues from the Department for Enterprise on additional measures. Mr. President, our public sector has a role to play. I am incredibly grateful for all those who are working to keep us safe and to keep the island running. I know that many honourable members were moved by the outpouring of thanks for all our carers and healthcare workers last night at 8 p.m. They are indeed heroes. I am sure that honourable members will join me in paying tribute to them.
Yeah.
But we must not forget our other emergency service colleagues who are working to protect us all. Mr. President, we must also recognise others. The housekeepers in the hospital who are playing such an essential role in keeping everyone safe. The workers in the Department of Infrastructure who are keeping our buildings, ports, roads and transport systems working. The teachers who are maintaining safe environments for the children of key workers, including over what would have been the Easter holidays. These are just a few examples. There are, of course, many, many more. We can be proud of how our public services have stepped up. Mr. President, I would also like to pay tribute to all those involved in the provision of food and medicines. They also deserve our thanks and respect. Thank you to the supermarket worker who is ensuring that we can feed our families. Thank you to those who work in the pharmacies that are dispensing essential medicines. Thank you to those in our local food production industry. Again, these are only a few examples of an impressive national effort. Mr. President, the great Manx public has a role to play. Community groups have stepped up. They are supporting those who are most in need of our help. Individuals have stepped up. I have heard powerful stories of people's selfless actions. There are so many people working to keep our community going. I am proud of our island. There can be no positive outcomes from this pandemic. There will be loss of life. Some of us will lose loved ones. Our island community needs to brace itself for that. For now, we need to pull together, work together, support each other, wherever possible, stay at home to protect our most vulnerable. Do this today, save lives. Mr. President, we will ensure that we regularly update this Honourable Court as often as possible, but I hope all members will bear with me. There are times when I am going to give an update and the situation has suddenly changed minutes before I give a speech. So if honourable members can bear with me, I will give you, of course, the respect that you deserve and the updates, but we're not living in a normal world. Thank you, Mr. President.
Thank you, Chief Minister. Honourable Member for Russian, Mr. Speaker.
Thank you. Could the Chief Minister perhaps advise the Court on what we know about the current cases and whether the and how it's being spread at the moment? Are these cases largely that have been brought into the island? Are they being transmitted in the home or at work? So that we can sort of reassure people about how the current spread is occurring. Could I also raise the issue of the advice that is out there about being able to leave and exercise once a day? I think this is one of the areas that's causing the most confusion. The message that we've heard unequivocally from NHS staff is that if you want to help, you stay at home for as much as you possibly can. However, people are liberally interpreting this ability to go out and exercise. Those who should be on lockdown, those who should be self-isolating, and I think it's one of the areas causing confusion, and I'm wondering if that might be advice that's revised, perhaps. And finally, is the Chief Minister giving consideration to closing of large shops where many people can gather in at one time, or restricting the numbers of people, even in large superstores, because that is, again, an area that's been raised as a significant cause of concern?
Chief Minister to reply.
Thank you, Mr. President. I thank the honourable member for his, Mr. Speaker, for his points. I hope I have noted them all down. There was quite a lot there. First of all, how has it spread? Well, of the 29 cases so far, Mr. President, 19 have been through travel. The amount regarding exercise, at the moment, the key comments are, if you are not showing any signs of coronavirus, if you've not been told that you have it and that you haven't tested positive or you've had a test, then if you haven't got any signs, you are allowed to go out to get key shopping or medicines. You are allowed to go for modest exercise. That doesn't mean to say you spend half the day out. And we're just asking people to be sensible here. If people abuse this, then we will stop it. So this is trying to look after people's mental health, their physical health, to enable them to go out for 20 minutes, an hour, exercise. But if people are going to be abusing this going forward, we may have to withdraw this as an option. So this is purely to help those people who maybe live in flats and don't have a garden. They maybe have a dog and that needs to be exercised. If they do not have the symptoms, or they are not under the restrictions because they've tested positive, then they can go out. But please follow the rules and keep your social distancing from people of 6 feet or 2 metres. You are not allowed to go into, if you're just exercising, you should not be going into shops. Now, if you have the symptoms and you're in quarantine, stay in means stay in. Now, we are obviously advising people over 70, people with health issues and pregnant ladies not to go out. But again, if you've got a garden or you feel you can safely go out and exercise for a limited period of time, that will help your mental health and physical health, then that is acceptable. So I hope I've been as clear as possible, but do not abuse it, or we will have, on the advice of our medics, to stop that from happening. I don't want to have to do that. It has happened in Spain, it's happened in Italy. If we have to go down that route, we will, but at this moment in time, people who are not infected, who are not showing symptoms, can go out. Now, I think the last point the honourable member, my good friend, the Mr Speaker, mentioned was large shops. And I know that the biggest supermarket on the island has now implemented a limit of the number of people that can go into the shop, and there are now queues outside, spaced apart with the social distancing rules, for people to wait. And I hope people will be patient. I know it's something we're not used to, but people will have to get used to it. If they want to be able to go out and buy food, get medicines, etc., and be safe, then they have to respect these measures. And if anyone is caught abusing the staff, then measures will be taken. And you've already heard yesterday, Mr President, I think that someone was arrested for that very offence of abusing staff. And I give credit to the police for carrying out that action as swiftly as possible. So we all as a community have to learn to be patient when we go shopping, when we go for our medicines, follow the social distancing that the shops are all putting in place. I've been around a number of shops, Mr President. There was maybe one area I wasn't happy with, but to be fair to them, they have put in significant changes since. So I believe that the restricting of numbers in big shops is already happening, Mr President. Thank you.
Honourable Member for Council, Mr Henderson.
I thank the Taoiseach for his strong positive statement to our community, but can he give us a little more information, what he can, with regards to local residents stranded away? He's quite right. We've all been some of us have been contacted by them, least of all myself. People who are desperate, they don't know what to do, they don't know where to contact. The only thing they can find is contact the British Foreign Office with regards to assistance. I think we need to be able to do more.
Chief Minister.
Thank you, Mr President. And we are doing more. We are working with a number of people. At the moment, we believe there are less than 20 people who are affected to date. We are working with them. But if all honourable members have anyone that contacts them, then please contact my team in the Cabinet Office, and we will, of course, collate these measures. But I have time and time again said, get home. Now, some of the people who have not been able to get back to the Isle of Man, through no fault of their own, have been stranded. But equally, I've come across cases of people thinking, well, they can just rack up, stay in Spain for a while, and the second biggest infected jurisdiction in Europe, and then suddenly decide, oh, I want to come home now, when they've had ample time to get home. So my heart goes out to those genuine people who have not been able to get home. They do exist, but we're not dealing with big numbers, and the Cabinet Office are currently working to see what we can do to help those people whilst they have to stay off the island. But as our medics have clearly shown, it is in the interests of all people that we have closed our borders. It was a tough decision, honourable members, but I believe we have acted for the best interests of all the people on the Isle of Man.
Honourable Member for Council, Miss August Hanson.
Thank you, Mr President, and I thank the Chief Minister for his statement, and also all of the Council of Ministers and the public the civil servants and the public servants for all of the work that they're doing at the moment. They're doing an incredible job. Is there any intention to expand testing criteria for frontline staff who are experiencing headaches, sore throats, in view of the number of people now being diagnosed who have non-specific symptoms? And also, if the Chief Minister could just make a short statement regarding the rise in domestic abuse incidents over in the UK, and whether or not, if he would just sort of put out a statement in that regard. Thank you, Mr President.
Chief Minister.
Thank you, Mr President. Well, obviously, we've upped considerably our testing, again, of people. I think we got it up to 75 yesterday, Mr President, from the 30 it had been previously. That's considerably more on a pro rata basis than the United Kingdom, when you're hearing of thousands maybe being done there. If you pro rata that down, it's about 6 people on the Isle of Man. So we have received the additional swabs that we were looking for. We are working hard now to bring forward those that have been in a queue waiting to be swabbed. And really, Mr President, it is not up to me as a non-clinician to decide how we test our important care workers and key workers. But I would put this out to you. If you're not showing any signs, you can do the test. It may not show that you have it if you're not showing the symptoms of the illness, and therefore I could test everyone in the hospital today and get a totally clear result, but they could still have it. They just haven't developed it. So it's not for me, or I believe this House, to be saying how our health professionals deal with the testing situation. It is for our medical experts to make those decisions, and I put my trust in them.
Honourable Member for Middle, Mr Shimmons.
Thank you, Mr President. I'd also like to thank the Chief Minister for his statement. As he knows, I am concerned about the plight of some Manx residents who are stranded outside the island. The question I have is, will he take action to explore the provision of a robust quarantine facility? Because we are going to need that at some point, and it seems sensible to start that work now.
Chief Minister to reply, please.
Thank you, Mr Speaker. Mr President, I do believe I owe an apology to the Honourable Member for Council, Miss August Hanson, because I didn't answer the second part of her very important question on domestic abuse. And I believe there is no tolerance for domestic abuse on the Isle of Man, I'm sure, in the United Kingdom. And if any reports of this are happening, then I'm sure my colleague, Minister Crageen, Minister for Home Affairs, will do his utmost to ensure that resources are put there to help people who are victims of domestic abuse. It could be argued that one of the many reasons we have allowed people to get out for exercise, etc., is for mental health, exercise, but also in this situation, people being able to go out to clear the air, etc. It's got to be a key element. But if it is abused, we will have to stop that exercise from happening. Moving on to my honourable colleague and friend, Mr Shimmons, my fellow member for Middle. And he's obviously sharing the concerns of all of us, I think, who have constituents who have been unable to get home. I have to say, honourable members, that I had expected the number to be significantly more than we are faced with, and I think an awful lot of people had listened to what we've been saying, and it's not just me, but other ministers have been listening to what we've been saying time and time again: get home. And obviously some couldn't for very specific reasons, for example, a cruise ship in quarantine, etc. So we are working on that. Now, yes, who knows, in the future, Mr President, there may be a time when we can get these people home, but that will only be when the medics have analysed the spread of the coronavirus on the Isle of Man, and when they feel it is safe to bring these people back, then obviously that will happen, and they will have to go into very strict quarantine. And we have been working with a number of hotels who aren't in the middle of towns, etc., to ensure that if that situation happens, and it's an if, Mr President, I cannot give a date, because at the end of the day, it is the advice of the medics on how the spread of this disease is going through the island, and how also things are going in the United Kingdom. But obviously we will do everything we can, but at the end of the day, my number one concern is to protect the large number, the 84,000 plus people of this island.
Honourable Member for Council, Mrs Paul Wilson.
Thank you, Mr President, and thank you to the Chief Minister for his statement. And like other honourable members, I also welcome his statements that work is being done now to look at the situation of the, albeit few, but still residents of the Isle of Man who have unfortunately been stranded before the borders were closed despite their best endeavours to get back. I wonder whether the Chief Minister would be kind enough, when some of the measures that he says are being worked up in the Cabinet Office at the moment, when those have been fully developed, if he would be kind enough to include in a statement to this Honourable Court what else can be done to offer support to these people, particularly if it is not possible in any way to bring them back, even under strict quarantine rules, for the foreseeable future. Thank you, Mr President.
Chief Minister to reply.
Thank you, Mr President. And of course I will do my utmost to update members and when we have a clear strategy in place for the number involved. But as I say again, Mr President, until our medics are content that the curve of cases on the Isle of Man is where they would like it to be, we will not be allowing people back onto the island.
Honourable Member for Middle, Mr Shimmons.
Thank you, Mr President. I very much hear the Chief Minister when he says he's following medical advice from the medical professionals on all these issues, and I think we appreciate that very much. The question I have is about testing, which seems to be absolutely critical in this global pandemic, and we currently have a situation where we're waiting many, many days for test results, and clearly that's suboptimal on multiple levels. I note that Guernsey now have their equipment to set up their own testing facility on island, which will speed up tests than currently waiting on the UK, which is currently obviously running behind. The question is, are we talking to our colleagues elsewhere for best practices? Because it seems it's going to be a number of weeks before we'll be in a similar situation to Guernsey.
Chief Minister.
Thank you, Mr President. I thank the Honourable Member for his question. Yes, we've already been working on this, and I don't think Guernsey will be ahead of us. We are 3 weeks away, Mr President, for setting up a facility, which if you've those of in the medical profession, I know in the pharmacy skills, Mr President, will know just how long this takes. So we are working on having our own testing facilities on the Isle of Man, and we hope that by the middle of next month we will have our own testing facilities on the Isle of Man. At this moment in time, we are reliant on testing facilities in Manchester and another of areas, and obviously they are swamped, Mr President, which is why we are seeing longer than we would expect delays in the return of the tests. But we have to accept, Mr President, that we are living in unprecedented times, and I've called upon people. I know if you're waiting for the results of a test, you're going to be so frustrated and worried, but please bear with us. Everyone is in the same situation, waiting for the tests from the UK, and we have been working hard behind the scenes to get a test centre on the island, which is only a matter of weeks away now.
Honourable Member for Ramsey, Mr Hooper.
Thank you very much, Mr President. I, for one, am actually very reassured by a lot of the things I'm hearing this afternoon, from the Chief Minister, and I'd like to thank him for that. I think the Honourable Member for Middle, Mr Shimmons, is correct when he says testing is key, but also is successful and effective tracing of contacts surrounding this. So I wonder if the Chief Minister can comment or make a statement, really, provide some information to us on how this is being done, how effective it is. And also, he keeps mentioning making sure that we're on track on that medical curve. I just wonder if he can advise us where we currently stand on that. Are we on course to having this resolved as the medics are predicting, or is it too early for us to know that yet? Thank you.
Chief Minister to reply.
Thank you, Mr President. I thank the Honourable Member for Ramsey, Mr Hooper, for his kind comments and valid points. I think, Mr President, the the reason why we've taken some of these draconian measures, such as shutting our border, is to see where we are. We are still waiting for a few hundred results to come back from the testing, and obviously we're doing a significant amount of more testing of our residents. We have the 111 helpline, which is working exceptionally well. We set up not just a helpline, we set up a proper call centre where medics were at the end of it long before any of a similar sized jurisdiction, and that's a credit to the team who were involved in setting up the IT, the medics working there. I think that they're well over, I forget the exact figures, whether it's a couple of thousand, etc. 3,000, the health minister says, phone calls that call centre has taken since it's only been going for a few days. That's how fast things are moving. So we obviously are not at our peak. Let's be blunt, we are on the start of a journey. The most important thing is the measures that we have put in place have been put in place to hopefully stop there being a spike in cases on the Isle of Man that goes through the hospital and our medical capacity. We are going to see an increase in numbers, but if we can manage that increase for a longer, wider period of time, so it doesn't go through the capacity of the hospital and our medical backups, then we will come through this to the best of our abilities. And that's why we've really acted first. Can any honourable member name a country that has fully shut down its borders, pulled the drawbridge up? We've been the first on a number of issues. I think we're the first country to insist that people quarantine for 14 days before we had a case. We have been moving incredibly fast on this, faster than other jurisdictions. We're trying to learn from them. We as a small island can do things that maybe bigger jurisdictions have done. And I noticed there was an article where the UK now are thinking of doing exactly what we did by pulling up our borders to anyone coming into the United Kingdom. But that's their decision to make with their own set of circumstances. I think the second part of the point my honourable colleague made was public health testing. And yes, that's something we're putting a lot of time into. A few hundred people have already been isolated because they were in contact with the people who have been confirmed as having coronavirus, and they are still contacting probably 100 plus people to ensure that they are aware that they have been in contact with someone who has coronavirus and that they should isolate too for the 14-day period. Thank you, Mr. President.
Honourable Member for Council, Mr. Mercer.
Thank you, Mr. President. Thank you for Chief Minister's statement. Can I ask the Chief Minister what political group is providing leadership during this state of emergency? How regularly does it meet and who are its members? And under what terms of reference does it operate? And what oversight is available to this court?
Chief Minister to reply.
Thank you, Mr. President. Obviously, the National Strategy Group meets every day. It has a number of members and they can fluctuate depending on the problem that we're facing at that day or that week. So if you park coronavirus, normally you would have the Minister for Policy and Reform, the Treasury Minister, the Minister for Enterprise and myself on that committee. Now, at the moment in time, we have the Minister for Enterprise, the Treasury Minister, the Health Minister for obvious reasons, myself, and until recently we have had the Minister for Education. But as the requirements on education have been sorted out, the need for the Minister for Education to be on that committee have reduced. That committee makes recommendations. It doesn't make final decisions. Those recommendations are then taken to the Council of Ministers, who then vote on whether or not they are happy with the decisions or the recommendations made by the National Strategy Group. The National Strategy Group is meeting every day. We are meeting over the weekend. It's not just every other day, it's every day. Every morning at 9 o'clock I have these meetings. We then have Council of Ministers at our normal time, but we had a meeting of the Council of Ministers today, Mr. President. So if we feel there is a need where maybe views aren't quite in total alignment, or members are wanting extra information, then we have emergency Council of Ministers or extraordinary Council of Minister meetings wherever is needed. And then the line of communication is, once we've agreed those powers and the Governor has signed them, we then have 7 days to take those powers to Tynwald to have it confirmed that you are content with the emergency powers that we are taking forward, which is why we find ourselves here today, Mr. President.
Honourable Member for Ayr Michael, Mr Baker.
Thank you, Mr. President. I'd like to thank the Chief Minister for his speech, in which he outlined both the speed of response, the collaborative working, the agility and flexibility which has been demonstrated as the island responds to this national emergency, the clear focus on beating this threat, and the national unity that has emerged. These are in response to a time of crisis. How does the Chief Minister believe we can ensure that this is retained when we move beyond this emergency? And does he agree with me that we need to be intentional in retaining those things so that we do move quickly, we do work collaboratively, we are agile and flexible, we still have a clear focus and a national unity as we move beyond this emergency into restoring the island to a hopefully an even better future than we have enjoyed to date?
Chief Minister to reply.
Thank you, Mr. President. I thank the honourable member, Mr. Baker, for his very good comments. And I think, whilst I've said this is a terrible virus and we're not going to have a good time going through it, there will be areas that we've put in place, items that we've put in place, Mr. President, that we will, when we have a debrief, we can say, right, what worked? What do we want to continue? And if those honourable members remember my world-famous trip to Christchurch in New Zealand to look at the Canterbury model of healthcare, they had developed that system following an earthquake where thousands were killed and all their key buildings were flattened, and they were able to come up with a new system of integrated healthcare in the community that helped, and that was seen as the example of how the world should carry out its healthcare services. Now, if honourable members remember a number of months when we, in a different world, it seems to be a different time, I announced a committee on community that Dr Allinson, the honourable member for Ramsey, is chairing, and that was designed to try and do more in the community to help people with social isolation, help people with mental health issues, help our young people who are losing the ability for confrontation on a day-to-day basis. All these things, I believe, we will develop systems so much quicker because the public has been fantastic in stepping up to help volunteer with other third sectors and our own social care services to look after our vulnerable people who are isolated and need help. And I think an awful lot of these measures we will retain. As I mentioned before, Mr. President, as the ex-president of the Farmers Union, buying local, making sure we have food security is another key thing that we must learn from this. Because if we didn't have our milk producers, our beef producers, our vegetable producers, our egg producers, we would be in trouble. So we need to learn from some of the lessons, we need to learn from where we've got it right and keep what we've got right going forward.
Honourable members, I have two more to speak. After that, I think we should move on with quite a full order paper. Mr. Robert Shaw.
Thank you, Mr. President. Can I take the opportunity to congratulate Mr. Mercer, Member for Council, for his first question in this court, and I'm sure it'll be the first of many, many to come. I say that on behalf of the Chief Minister, who I'm sure has a myriad of things on his mind at the moment. Referring to that particular answer to Mr. Mercer's question, I have to say, Mr. President, I was surprised that he said that the Minister for Education has been removed from the National Strategy Group as I understood him saying that the issues are resolved with regard to education. Can I remind the Chief Minister, Mr. President, that on Tuesday I made a particular point about, as clear as I could, but perhaps not as clear as it should have been, that the hub schools, the primary hub schools, although intended to help key workers, particular with regard to the National Health Service, were also one at the same time an Achilles heel for the National Health Service. And as a consequence of those concerns, on Tuesday, I asked the Minister for Education whether, once he was clear about the attendance in these schools, because being on Tuesday, it was the first day of the hub schools, Mr. President, so it was a little early. And I asked the Minister for Education whether he would come back to this Honourable Court with a clear assessment of the risks that are associated with hub schools, and he promised that he would do so. There has been complete silence today, and I understand from your words that he will not be giving a statement today. Mr. President, can I ask the Chief Minister whether he would discuss this matter with the Minister of Education and ask him two questions? Would he, when he gets the opportunity, ask the Minister of Education to indicate as soon as he can when that crucial information is going to be made available to honourable members, and also whether effectively that information will include a very clear assessment by the most senior clinicians as to whether hub schools actually contradict that very, very important advice that has been brought forward in recent days to the general public and to ourselves. Thank you, Mr. President.
Chief Minister to reply.
Thank you, Mr. President. And I hope the honourable member doesn't feel that by removing, for the time being, the Minister for Health and Education, Sport and Culture from the National Strategy Group, that we don't value, obviously, his involvement. It is fluid. If we feel we need a minister to come in to discuss a certain issue, we will bring that minister into the National Strategy Group. The honourable minister has been a key member of that committee, that group, whilst we've gone forward with the key issues. But now that we have closed the schools, bar the key ones, it was felt that he needs to be able to concentrate on working in his department on those areas. He has done a number of radio interviews and media interviews with myself and on his own, of which I commend him for. I am sure that the issues the honourable member has raised, the information he is looking for, that he will get that out to members in the very near future.
Thank you very much. Final question, Honourable Member for Onchan, Mr. Callister.
Thank you, Mr. President. I also thank the Chief Minister for his very passionate and leadership speech this afternoon. On occasion, Mr. President, this island has had to exclude people from our island for various reasons. Can I ask the Chief Minister what the stance is at the moment with regard to individuals? And can the island still exclude people from this island if it sees fit?
Chief Minister to reply.
Thank you, Mr. President. The way our legislation has been set up is that if people need to go away for emergency medical treatment in the United Kingdom, they will be allowed back under strict quarantine rules and regulations. People who we may need, say, if the power station broke down and a key piece of equipment needed somebody to fix it, the powers are there to allow them to come over, fix it, go off the island.
Would the member give way?
Yes, certainly.
I don't mean for medical reasons. I'm talking about if it's a crime or somebody who's actually, living here temporary under work permit sort of circumstance, has committed a crime which would normally result in someone being excluded from our island not to return. What would happen in this particular circumstance as we go through a state of emergency and through this pandemic? Does the Isle of Man still have those powers to actually remove somebody who should no longer be on our island any longer? Thank you, Mr. President.
Thank you, Mr. President. And my understanding is that, yes, you can still leave the island. We have not stopped people going off the island. We are just saying if you choose to go off the island, you will not be allowed back until we have lifted those measures. So, yes, and I will obviously give details to the court, all honourable members of this court, Mr. President, if my information is incorrect, but I don't have the benefit of having the learned Attorney General here with me to confirm this, but I'm pretty confident that if you commit a misdemeanour that would ensure that you are asked to leave the island for the various work permit rules and your conditions of being on the island in the first place, then we would still be able to enforce that because people can leave the island.
The learned attorney is, of course, in the court, and although you can't see him, Chief Minister,
above you.
He's always above me, Mr. President.
I'm sure he's taken note of what he has heard, and it can be taken from there. Thank you, Honourable Members. Thank you, Chief Minister.